I'm now on my second TKI since June 2016, so very long time, and I have no evidence of disease and almost no side effects. The first year of my diagnosis, I was treated in a general hospital, and there the word resuscitation was never mentioned. But after progression of disease, I had to move to an academic hospital, and during the intake we had quite a conversation about it, not just resuscitation, but also taking part in a research program, how to communicate with each other, what role do we want each other to have, and also the communication style and what kind of involvement I wanted to have in my own disease. And my oncologist mentioned the fact that there is quite a magic about resuscitation and that the outcome are mostly very poor. And he asked me, if you are lying dead on the ground, do you agree that we won't act? My husband was not there, and I had a good friend with me, but I was shocked because even I thought the conversation was necessary, but if your oncologist talks about the death, it's final and it becomes very real. And as a patient, you only want to hear about hope and about living and about surviving. And later on, my good friend and me, we spoke about it some more, and her father had resuscitation, and he came out very poorly. So we, before I got ill, we already agreed that I didn't want resuscitation. My oncologist and I speak often about resuscitation or ICU and what we should do when I get very, very sick. During the COVID pandemic was an excellent opportunity to talk about it, because then you had the question, will I go to ICU if I get very ill, and how do I get my medicine, and etc. So then you talk about the end of life, and that was very very fine to have this conversation, that he knows what I want, and I know what he wants. Although it's very hard, because if an oncologist says he doesn't want to do a resuscitation, then he's in control, and for me it's very important to have control of my own journey. I don't think there is a good timing to speak about resuscitation. If you are just being diagnosed, your whole world is upside down, and you're not capable to think clearly. And if the oncologist is also mentioning resuscitation and that you're going to die, it's too big of a burden for the most of the people. But it's never the right time, and you have to have an agreement with each other. I think it's part of the relationship, part of the communication plan between the oncologist and the patient, and that there should be some kind of a relationship that you can mention these kind of things. And I think it's all about communication and taking the patient seriously, but also to look
what every patient needs and what every patient wants. So look at the patient, look at how to communicate, and never is the right time. So please do it in a quiet setting so that the patient can adjust to that kind of message.